know working in a large healthcare setting, they said, we need you here, and we're gonna kind of battle for time off between 17 other people. And coming into a smaller setting, there's so much more flexibility and opportunity to make things work between you and your patients and your coworkers that you don't get in larger settings. I enjoy living and working in Freeman because of the friendships and community that you get to build. My husband is originally from Freeman, and now I joke that I actually know more people here than he does. As someone that came into this setting with not knowing many people that worked here, it was very welcoming and really easy to kind of find a community and a crowd.
Freeman Regional Health Services is a critical access hospital with a wide variety of services. We have a clinic here in Freeman. We also have clinics in Menlo, Bridgewater, and Marion. Our clinic is co-owned with Avera, and our doctors are also employed by Avera. We have an attached nursing home with 45 licensed beds, and just down the street, we have a 35-bed assisted living center with independent apartments as well.
Freeman Regional Health Services is our largest employer, and they are really a big reason, I believe, why Freeman is Freeman. It's a vibrant community of young professionals ready to invest in this next chapter in our community.
It's really important to us here at Freeman Regional that we provide our employees with a wide variety of professional development opportunities for both individuals and teams. We often send individuals to conferences, in-person trainings, advanced trainings, just so that we can make sure that we're helping them develop professionally and personally, but also ensuring that we're providing the best care possible to our patients and our residents.
It's unique that we have such a close relationship with administrative personnel, so it's kind of nice to ask them, hey, can I do this continuing education and hear the benefits that we might be able to offer the community. And they're always thinking a little bit more so outside of just the financial benefits, but also what unique services we can bring back to the smaller communities so people don't have to travel to get those services.
Our goal at Freeman Regional is really to invest in others and serve others. Our providers and leaders really have a desire to help students grow and learn and to see if they really want to work in healthcare their whole life. We offer shadowing, clinicals, and just really any kind of support that we can offer these students to help them know if they like the healthcare setting or not. So just recently, actually, we partnered with the South Dakota Department of Labor, Lake Area Technical College, and Freeman Public to create a CNA apprenticeship program. And so it's very exciting. The students, they can get high school credit all while getting paid and going through this apprenticeship program. And upon completion of this, then we can also offer them a nice scholarship.
I grew up here in Freeman, and I moved to the cities for 10 years, and I thought I would never move back. But I moved back here to raise my family, and I didn't know even how wonderful Freeman was when I was moving back. And so we are invested in our young here, and we want to grow our own because we have a workforce shortage, and it's not going away. And so we want to invest in these kids so that they can help, whether it's in Freeman or in any other community throughout the country.
As sometimes people just find us because they're looking for a new community and they happen to realize that the cost of living here is great. Your money will stretch much farther right here in Freeman than it will in a bigger community. You know, we're just a short drive from larger cities like Sioux Falls, Mitchell, Yankton. It takes a matter of minutes. In fact, we're right along Highway 81, and we're within 30 minutes of both of the interstates that cross South Dakota. We're finding, though, that people who've moved here are realizing, I really don't need to leave and go someplace to get those things, to really great grocery stores, 3 banks, convenience stores and such. We have a full range of healthcare services. We have dental, vision, chiropractic, veterinary care. We have a local ambulance service. It's a wonderful community to live in, especially for aging in place. People come here, they love it here, they stay here, and they're able to do that very successfully. Another hidden gem is our 40-acre Freeman Prairie Arboretum. It's just unheard of for a rural community of our size to have something like that here. Well, a lot of times people will recognize us as the home of Schmeckfest. It's a German celebration that started up over 60 years ago and has kept going with German foods and then high-scale musical production every year. The other thing that we're known for now is the South Dakota Chislik Festival. That started in 2018 and more than 8,000 people came to Freeman that day for the South Dakota Chislik Festival.
We have many opportunities right now to serve at Freeman Regional. We're looking for CNAs, patient care techs. We're also looking for nurses that would be interested in working in the hospital, in the nursing home, or at the assisted living. We're also actually right now looking for a radiology tech as our radiology department is growing. And another opportunity at Freeman Regional is in our Human Resources Department. We have many competitive employee benefits at Freeman Regional, including health, dental, and life insurance plans, paid time off, a retirement plan, and an employee referral program that rewards employees for recruiting and promoting Freeman Regional. We also support the Build Dakota and Rural Recruitment Assistant programs. Really, our employees say the most valuable benefits at Freeman Regional are the positive culture and flexible work-life balance.
So we have had collaborative efforts to make things happen. We have a brand new 18-lot housing development, the Westward View Edition. Our community is what it is and is so much better for it because of the role that Freeman Regional Health Services has played, and their auxiliary as well has been very active in our community. Living in Freeman, though, offers just a special quality of life where we have access to the things we need and we're not disconnected from the rest of the world. I think people who come here will really love it. That's what we're hearing from people who just found us and people who've chosen to come back to us after exploring other places.
Our relationships don't start and stop at the beginning and the end of the workday. We know each other in this community and we love and care about each other. And really what I see here at Freeman Regional is a team who is really giving back to those who invested in them earlier in their lives. It's about serving our elders, it's about serving our community, and it's ensuring that we see this place and this community into the future.